Hi, my name is Chloe, and this is my injection of a intramuscular injection video for course BSN 225, section 9. So this is my workspace today. We have our patient, we have our medication, we have a pair of clean gloves, our gauze, alcohol swabs, and our syringe. Normally the order calls for a 22 to 25 gauge with 1 to 1.5 inch needle, but I don't have that in my kit, so I'm just going to be using the tuberculin safety syringe. So I'm going to be using that today. So the first step is to make sure that we have all of our supplies, and then we want to go ahead and go over the 6 rights of medication, which is right patient, right drug, dose, route, time, and documentation. Once we do that, then we want to go ahead and go over the patient's order in the EHR for the medication. Make sure that everything's lining up, and we want to be making sure that we are doing identifications throughout the procedure, just to make sure that there are no errors. Once we go through all of that, then we're going to go ahead and go over the calculation dosage. So for the order, again, I'm just going to be using this one, but the order is to the order is 6 milligrams, but it's 4 milligrams per milliliter, so we need to go ahead and convert it. So we're going to do 6 divided by 4, which gives us 1.5 milligrams, I'm sorry, 1.5 milligrams. So we will do that. Once we've done the calculation, then we will go ahead and go into the patient's room. Okay, knock, knock. Hello, my name is Chloe. I'm going to be your nurse today. I'm going to go ahead and close the curtain for privacy, wash my hands, and during that time, I would observe the room, see if there's any visitors or family. If there are, we would check with the patient to see if it's okay with them staying, or we would ask them to leave so that we do not regulate any HIPAA regulations, okay? So there are no visitors or anyone else in the room, so that's not an issue in this case. So, hello, Miss Smith. I'm going to be your nurse today. Can you please verify your name and date of birth? Okay, perfect. This would be a good time to verify the information that they gave us with the order and the medication, just to make sure, again, like I said, to lower the risk of any errors. So we want to make sure that we're double checking on that. So we would do that. Next, I'm going to go ahead and ask the patient if she has any allergies. Miss Smith, do you have any allergies that we need to be aware of? Maybe to any medications, foods, seasonal allergies? No? Okay. Do you have any questions today? How are you feeling? Great. So now I would go ahead and wash my hands and put on a pair of clean gloves. So, Miss Smith, today the doctor has ordered a medication for you. So I'm going to go ahead and prepare everything so that we can do the injection. It's morphine sulfate. So basically, it's an opioid used for pain. And there are some possible side effects that could include nausea, vomiting, maybe headaches or burning or stinging at the location site of where we inject. There may be some adverse effects, which could be chest pain, respiratory distress, anything like that. We want you to let us know so that we can help you to the best of our ability. So now that I've gone over the stuff with the patient about the medication, I would make sure that she doesn't have any questions. Ms. Smith, do you have any questions? Okay, I'm going to go ahead and get the medication ready. So I'm gonna keep this open so that I can use the one hand scoop method. So with doing a medication, if the lid, well, what we're gonna do is we would clean the outer surface. I'm not gonna open the swab just because I'm almost all gone and this is all I have left. So we would just clean and dispose. So once that's clean, we would get our gauge of the needle. Oh wait, no. Before we take it off, we're going to fill up the gauge with the amount of medication that we're going to be doing. So since we're doing 1.5 milligrams, I would fill it up to that. Because I don't have the correct needle, it's not on here. This is measured in milliliters, so we're just gonna pretend for right now, but that's what I would do. So I'm just gonna go ahead and put in air to, let's just say 0.5. Okay, so hypothetically, 1.5 milligrams. So once we inject it with air, that's when we remove. And I'm going to place it right here just so that I can be able to go back and get it. So now I'm going to inject the needle into the medication. Okay, now I will push the air in there. Okay. Now we will draw up the medication. Again, making sure to draw up the correct amount for the order. Okay. Now we're going to go ahead and tap just to make sure there's no air bubbles. If there were, we could push the medication back into the vial. And if there was a lot, then I would redo this whole step just to make sure that there was no bubbles. Okay. Now I'm going to take it out and do the one scoop method. And here is the medication, which is 1.5 milligrams of morphine sulfate. Okay. Okay. Next, we would go ahead and find the site that we're going to be injecting, which is the ventrogluteal site. So once we find that location, then we're going to go ahead and inspect. This would be a good time to point out any redness, lesions, bleeding, swellingness, anything that we need to be aware of to go ahead and chart. Everything looks good though. Then we're going to go ahead and palpate, just looking for any tenderness. Okay, everything looks good. Okay, once we do that, then we want to go ahead and I'm going to place my hands on the site to go ahead and find the exact location, okay? So what we do is I'm going to go ahead and place my palm on the greater trochanter, right there. And then I'm going to place my thumb pointing at the anterior anterior iliac spine, and then this finger is going to be the posterior iliac chest, and then these ones are going to be pointing towards the buttocks. So as you can see, we have like a V-shaped, and the medication gets injected right in the middle right here, okay? So now that I've placed the location of the site, I can remove my hand and I will now clean the site, making sure moving inner to outer. dispose of that. Okay, and we don't want to blow on this or wave our hands to try and get it to dry. What we want to do is just let it air dry. Once it's ready, then we can go ahead and prepare to inject the medication. Ms. Smith, do you have any questions before we go ahead and inject? No? Okay. This would be another good time that I go ahead and check for patient identification, checking the order of the right patient, just to make sure that we are doing the proper medication and to the right patient. Okay. So once I've checked that, then we're ready to go. So next I would go ahead and place, okay. So I accidentally did it with I was showing you guys with my dominant hand, but it would be with my non-dominant hand. So I'm just gonna go ahead and rotate. And I know where it needs to go, so I'm just gonna place my hands right there, okay? So I'm going to take off the cap. Now we're gonna go ahead and inject at a 90-degree angle, okay? Ms. Smith, I'm gonna go ahead and inject the medication now, okay? 1, 2, 3. Okay, now I'm going to get a good grip with this hand. And I will inject the medication. Once it's injected, we want to wait 10 seconds to remove it, okay? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Once the 10 seconds is up, then we can go ahead and remove it. Just like that. And making sure to put the gauze, okay? Now I will discard this into the sharp container and the biohazard. That's trash too. Okay. Sometimes we can put a Band-Aid on if needed, if there's any blood, but it looks good now. Okay, Ms. Smith, we are all done. Do you have any questions? How are you feeling? Any side effects? No? Okay. Well, if you do start to feel anything, please let us know so that we can help you, okay? I would then go ahead and remove my gloves after making sure that everything is disposed away. Discard those, wash my hands, and chart. And that is it. Thank you.